As I said as well, the PCR tests, all the time I have said the PCR tests, there's evidence there that they're not accurate. Why have you touched a fight against the antigen test? And then to have a publican that doing his best to keep his pub going, keep the COVID free with antigen tests. And he had to be arrested. I don't know what's going on, and we're creating a time of fear. And it's back to days in Russia and communist countries. That's what it is. Don't talk to people, don't engage, don't crowd. And I don't want anyone to crowd. I want to respect hygiene and people be careful and mind their elderly. But you put people with COVID into the nursing homes and cause the spread of it. You still have a problem with nursing homes. I want to salute every nursing home to get endeavours they have made to keep it out. But you put them in. The Department of Health and HSE put people with COVID in there. It's the war trials in The Hague it should be brought to for war crimes against humanity. That's what should be done with the ministers, Harris and indeed Donnelly and his officials. Put people with COVID in there. But they had no resources, left, abandoned them, many cases of it. So as well as that, I want to also say to, as I said, the guarantee of efforts have been made. I have been raising many issues here, and thankfully we worked through some of them, dancing, the Nadine Egg, Ring, Carisha, Tipper Dawn. We can dance again, Count Corey, and come next we'll be able to do a real few. We won't have lost all the talents. The musicians have been vilified and petrified, and the funding hasn't got down to them. Big funding has got the big bands, and multiple, lots of funding in some cases, because the squab at doing the adaptations and the grant application forms hasn't got down to the ordinary man in the van. I have them in Tipperary by the spadeful. You have them as well. Matt Patsy in Carrick-on-Suir, you know him well, Minister. I have Fran and Muriel, and I have indeed Trudy Lauder, who entertained us on the 88th last night. There are countless, Willie Bunn, you name them, they're there, Paul Efford, brilliant people, but they have all been denied the right to work. So we haven't the right to work. So this motion, as we brought forward here today, was an attempt by us to have a proper debate. We have no debate on the vaccines, none. We have a small bit of a debate this evening. We look for extra time. Our group will have 6 minutes. Our group gave our 2 hours today to this serious motion that has such a wide impact across a wide range of societies, and we're looking for multi-disciplinary strategy for an exit. We must keep the businesses going. The publicans have been vilified and destroyed. Small pubs, the horrible name. And when I asked Board Falter at the Ask Committee, they said they didn't give them the name. I asked them who came up with the €9 bill. They said they didn't. So who's cutting who? It's a case of around the kitchen and mind the dresser, and we won't get the truth. We have to get the truth. None of our people in the rural independent, and myself included, are anti-vaccine. We have huge concerns about the lack of debate and transparency. We saw that yesterday. We haven't any sign of a kind of a scheme to support people who, and they do with all vaccines, have repercussions and get ill. And that hasn't been discussed. The Minister said yesterday, or the Taoiseach, that he discussed it at Cabinet and looked at some report. Why isn't that there? Why is it on the push? And how dare Deputy Adam Kelly take it upon himself, taking your job, I say, Count Cola, to write to all of us, put in our pigeonholes, if you wouldn't mind, to demand that we sign up to his vaccine policy. I wonder, has he invested interest in the vaccine policies? He must have something, because every day he gets up here, he's talking about nothing, only vaccine. He needs some kind of injection to get him off that topic and look after the people of Tipperary. That's what he needs. How dare the cheek of him, the arrogance of him. I didn't reply to Rob won't be intimidated or bullied by any other TD in the House. It's a free democratic country we live in, and we'll make up our mind with the advice of our doctors and consultants and specialists. I've underlined issues myself. But for my fucking score, Count Cola, I want to say that we must bring the people with us, and we haven't. We've left them behind, as I said, the publicans. The people denied to go to Mass. The people denied, their rights. And I said the school children blown out the window, and the department to bully that teacher to open up again. That teacher and board of management do a service to the people, and they decided to close the school because of fear. I'm saying to you, Minister, the marches will continue in Carrick-on-Suir. Minister Butler, meet that group, as I said, Councillor Dunn and Councillor Burke and their teams, and above all the staff, Dr. Flanagan and the people there. Meet Councillor Michael Smith and his team, for that wonderful Dean Maxwell in Tip Town. Stop this bullying and intimidation of wiping away our services with the HSE. They've been found cotton-napping here, been unable to deliver and respond to this pandemic. They can't respond to the winter flu. HSE in the department had lost 500,000 flu vaccines, and now they want to administer 8.5 million of them. I have no faith in them whatsoever. No faith in them. So we have a lot to sort out. We have a lot to get fixed up, Minister. I wish you well in your stint in the department, but it takes some moving. They need to listen to the people. And the fact that they're unelected, unaccountable, is shocking. We're elected, and we're elected by the people for the time being, and I value that and respect the mandate. But these people can come in with a decision just even 8 senior officials came into that meeting, a Zoom meeting. I struggled to get on with technology, but 8 of them to tell us, sorry lads, it's over. You don't have any more long-stay beds in Dean Maxwell. You were told us last week, and he went on radio then to an insult to injury to say that it's closed, it's gone, finito, forget it. You're going to put diabetic services into it. There's a monstrosity of a primary health centre in front of it, half empty. Put all the services right in there. gave us back our wonderful hospital in St. Bridget's, gave us access to our hospice beds, that people got excellent palliative care families. And we have a lift in the building, and we have showers in the building. It's not Dickensian, it's no older than Clonmel and many other district hospitals in the country.